Today I'm going to be filming my final OSCE video, and before I get started with that, I'm going to make sure that I have my ID band that's visible for my patient. I don't have any jewelry. I have my hair up off the back of my neck, no makeup, no nail polish, and I have my watch that's ready to create a professional environment for me and my patient. Before I get started, I'm going to put on some hand sanitizer that has alcohol in it, rubbing vigorously in between my backs of my fingers, under my nails, on my wrists, using lots of friction until my hands are completely dry. Now I'm ready to go see my patient. I'm going to close the door behind me to create some privacy for me and my patient. Hello, sir. My name is Rachel Cunningham, and I'm a first-year nursing student with the University of Windsor. Could you please give me your first name and last name and your date of birth?
Andrew Cunningham, September 19th, 1969.
All right, I'm just going to check that on your wristband for you. All right, that all seems good. So, have you had anything to eat, drink, or smoke anything in the last hour?
No.
Have you exercised in the last hour?
No.
All right, all good. So today I'm going to be taking your vitals for you, and so we're going to start off with temperature. So I'm going to be sticking this in the back of your mouth underneath your tongue, and I'm going to ask that you please do not speak or open your mouth because it could create a false reading. So open up, lift your tongue up please, up, close your mouth. All right, thank you. So your temperature is 36.1 degrees Celsius, which is in between the normal ranges of 36 to 38 degrees Celsius. Some factors that can affect temperature include stress level, age, or physical activity. So the next thing I'm going to do is to be assessing your pulse. So I'm going to, please show me your wrist. I'm going to be putting my fingers right below your thumb, and I'm going to be palpating the tendon that's right below it, and I'm going to be measuring using my watch. 0. All right, thank you. I'm going to ask that you put your hand back down. So your pulse was 80 beats per minute, which is in between the normal range of 60 to 100 beats per minute. And some factors that can affect your heart rate include cholesterol levels, anxiety, or any heart conditions. So the next thing I'm going to get started for you today is I'm going to be measuring your respirations. So what I'm going to ask you to do is put your hand across your chest like this, one hand across your chest. I'm going to be measuring that your breath is equal and symmetrical, and that it's at a normal rate. And if it's irregular, then I'm going to ask if I could please measure it again on your other side. This is my first time, so I'm only going to be measuring one time. So just please breathe normally. I'm going to be counting for 30 seconds. All right, thank you very much. So it seems that your respirations are 16 respirations per minute. That means that one inhale and one exhale is one respiration, and I measured for 30 seconds, so that is equal to about 16 respirations per minute. And that some factors that can affect your respirations include respiratory illnesses, physical exertion, or anxiety levels. Next thing I'm going to be measuring, or at least be talking to you about, is your O2 saturation. I don't actually have the machine to be testing your oxygen saturation, but what it is it would be clipping onto the end of your finger, and it would tell us the percentage of oxygen that's in your hemoglobin of your blood. So the normal ranges is between 95 and 100% oxygen, And if it's below 90, then I would have to start an intervention for you. Some factors that can affect it would be if you have any sickle cell anemia or any other respiratory diseases could be affecting it. And I would just be measuring to see if everything is completely stable and normal. And finally, I'm going to be assessing your blood pressure. So I'm going to be asking that you swing your legs over to the side of the bed. Help you up there, sir. Putting your feet on the floor.
I had a shower.
Yes. I'm going to be putting this around your arm. Getting out my stethoscope. So it seems that this blood pressure cuff fits properly because there's roughly 2.5 centimeters above your elbow to the blood pressure cuff, and I can fit one finger comfortably underneath that. So first what I'm going to be doing is I'm going to be measuring your systolic. Please rest your hand out properly like that. There we go. One finger under. I'm going to be measuring your systolic. So what I'm going to be doing is I'm going to be placing my stethoscope onto your brachial pulse. And I'm going to be inflating it 30 above where I hear your last beat, which is 50. Slowly releasing it. 2 per second. All right, so your systolic blood pressure is 120. And I'm just gonna wait 30 seconds roughly in between taking your full blood pressure. So how's your day been then, sir?
It's been dynamite. Awesome.
Have you had any family visit you?
No.
Not today?
No, just Sam.
Just Sam? Oh, that's good. Well, it's been roughly 30 seconds, so I'm going to be measuring your blood pressure one more time, this time checking for your diastolic, which is the
I always
last
thought
beat.
you could do it both at the same time.
To do it properly, you have to do it separately. So now I'm going to be inflating the blood pressure cuff. .30 above your systolic, which was 120. Releasing it 2 below every second. All right, so it seems that your diastolic is 80. So your full blood pressure is 120 over 80.
That's perfect, isn't it? It's
Yes,
damn near perfect.
It is between the normal ranges, which is between 100 and 39 over 60 to 89. So that seems about normal. So I'm going to ask that you please put it back into your bed. All right, do you have any questions then for me today?
No.
Okay, I'm going to be giving all of your vitals to your nurse practitioner or your doctor so that they will know when to update you. I'm going to leave you this call bell right beside you here in case you need me the next time I see you. I hope you have a good day, sir.
Great.
Okay.